Oh,
I did that. So now we actually
Yeah.
are live. It doesn't start till 5:30.
All right.
So everybody, we start in 3 minutes.
Good.
But I discussed this. I have to get a little bit of coffee, otherwise
I'm
I'll
going.
be at 97%
I hear you.
efficiency.
Last week I was having like 4 Diet Cokes a day just to keep going. I'm on day 6 with no caffeine to try and be healthy.
Really?
I'm telling you, it's rough.
Okay. Well, you know,
I know there's caffeine on it if I need it.
water is one of the main ingredients in coffee.
I know.
All
trying to
right,
stay
there
hydrated.
you go.
Right?
I think the
We're
science
making
is
arguments now. Yeah.
coffee is highly correlated to water.
Right?
Can't miss it.
Gotta stay hydrated. The key.
I read this article the other day saying that like 30% of Americans think that chocolate milk comes from brown cows. I was just thinking, oh, it's just brown
I
water.
love it.
It's just brown water. Yeah, so we got just a minute here. The public will start to join.
Great.
If you can silence your phone.
Yeah.
I have to remember to do that. Otherwise, your what's it called? Your merengue
Right.
ringtone will
Ringtone.
come out while
Yeah.
while we're talking COVID. Yeah, so I'm gonna start with COVID.
Great.
Give one quick plug. In the boardroom. Love it. CPR and first aid
Nice.
training.
Oh, that's great. Good to do that.
It's always great to have that. All right, folks, thank you for joining me.
Cool.
My name is Diego Ochoa, Superintendent of the San Mateo-Foster City School District, and I am here with 2 very great educators in our district. To my left, I'm going to let him introduce himself,
I'm Patrick Gaffney. I'm the CBO for the district.
the Chief Business
Official.
Official.
Yeah.
What an exciting title.
Exactly.
And we have, to my right,
Dr. Christian Rubalcaba, and I am the principal of Abbott Middle School.
yeah, thank you for being here,
Of course.
Dr. Rubalcaba. And we do have 2 people off camera that I just want to thank for being here again. Our communication specialist for the district office, Diego Perez. Thank you, Diego. And our director of technology, Peter Cazanes. Thank you, Peter, for being here. He taught me how to press the button that says go live, so I appreciate that. Tonight will be the first night where I kind of went through that process. One quick update that came from our coordinator of student services, and that was Susie Riley. This is a flyer that I'm going to tell the public about. We've got a lot of employees who tune in, a lot of community members who watch. And our district is actually hosting CPR, first aid, and AED training here at the district office in the school board room from 8:30 a.m. until 1:30 p.m. on Thursday, September 16th, on Saturday, October 2nd, and on Monday, October 11th. So I really want you to look into that. You can contact Tina Giusti. She works here at the district office for more information. This is a visual that we'll be sending out tomorrow morning once we check our translation. It is a document that we have been working on this week. It's a 4-week new COVID cases report. So what you're going to see on that report is you're going to see that in week 1 of the school year, which was those first 2 days of school plus the Saturday and Sunday, there were 8 cases of COVID that were reported to us district-wide. The second week, it bumped up to 16 cases, and that was the week ending August 22nd, that Sunday. In the third week, if you all recall, we implemented the testing at Foster City. That was the night that I was out there with the principal, Principal Gall. There were something like 700 people got their COVID test that night, and that was through the partnership with Virus Geeks. And then the third week was 21 cases. And then this last week, which just ended on Monday, September 5th, was 17 cases. So we've seen sort of a high mark in that third week. And as you know, we started this program September 1st at George Hall. And actually, Dr. Rubalcaba, it was at your school this Saturday. Will you just talk to the public, talk to the
Yeah.
families about that testing? What was that like? Tell us about that process.
No, it was a great experience. The Virus Geeks team and I went into it thinking, oh, folks might not show up, right? Because it's a 3-day weekend, but it was really well attended. Every couple of minutes.
And your school is on kind of 35th Street and Avenida de las Palmas, kind of in that little area.
Yeah, so Alameda de las Pulgas and 36th Avenue.
Yeah.
And
Just right up the street from your old school.
correct, right up the street from Laurel.
Is that where Laurel's at, 35th?
36, yeah, exactly.
Yeah.
And it was a great experience, families, I took the test myself.
Yeah.
So, I made it very, public that, that this is a great opportunity, right, to come get tested. And
So on Saturday, you actually went and got tested.
I did.
Oh,
I
good.
got my results within under 48 hours. It was kind of a really quick turnaround.
Oh, that's great.
We had some staff members coming through.
Yeah.
We had parent volunteers to help,
Yeah.
registering. What was really neat about this experience is that it was really easy. You didn't have to register before. I mean, there's a QR code that you quickly use by scanning your phone.
Yeah.
And it's a quick questionnaire and you're in really quickly. So it made it very easy to kind of get families in and out safely.
And actually, the next day, on Sunday, we implemented COVID testing at Beach Park. And I think the same kind of assumption was made, like, oh, people won't show up. But I got a text message from the principal with a picture of the back of people's heads, and there was a row of people walking up. I think that's kind of something that is important for us to acknowledge that we've done this year. We've sort of been more willing to kind of stop on a dime and kind of implement a process. We felt like it was important to get people tested for COVID. So we figured, let's use the resources we have in town and let's get COVID testing put together. For the parents and families watching tonight, we have testing going on right now until 7:30 at both Beach Park and George Hall. Tomorrow night is Fiesta
in Abbott Middle School.
Abbott Middle School. And then Friday is Foster City. And then it follows that process the next week. Monday night or Tuesday night, Sunnybray. Wednesday night, Beach Park and George Hall. Thursday night, Fiesta Gardens and Abbott. And then Friday night, Foster City. And so Diego off camera here, but when we send out this document, let's also attach this document to the same email. That way families can see the path and then just be reminded about what testing is coming up. Yeah, not to lose sight of the fact that we are also offering pooled testing. It looks like our actual start date is looking closer to September 20th. We were hoping, fingers crossed, for the 13th. I want to remind the public and remind employees, we are working with the vendor, so it's not really only on our terms. If it were up to me, it would have started last week. But we're feeling good about that getting started here. The 20th is the new date that they're starting to share with me. Of course, that pertains to our pooled testing plan. Our pooled testing plan, to take parents through it one more time, is a plan where we basically go into each school and we give entire classrooms of kids their own Q-tip, basically. So if we're in one classroom, the 25 of us all get a Q-tip and we do 4 circles in each nostril. Then we get a container and we put our Q-tips in that container. And then we send the container for testing. And the reason to do it that way is it would take an entire day to test your school if we did one kid at a time. So this brings tests together. We can test an entire class in 5 minutes.
Right.
Now, if that test comes back positive, then we come back and we retest each kid with a rapid antigen test, or sort of a 15-minute test, to find out who in the class may have COVID. And then those students are immediately sent home. Yeah, so those students are sent home and everybody else continues attending, modified quarantine, masks on. you're at the sites every day. How is mask wearing going at Abbott Middle
Yeah.
School?
At Abbott Middle School, it's going great. You know, we are not having any complications with students.
Yep.
Whether in our general education classrooms or in our special education classrooms, they're wearing masks. I think society has done a very nice job in supporting them and priming them in public spaces, and it's great.
Yep. And look at this. This is a report we put on our district website. Just a real simple chart. Will you read the first line there at the top?
Yeah, Abbott Middle School 0.
Well, it says
Every
COVID-19 confirmed cases.
Well, you know, I was drawn to Abbott. So.
This is actually on our district's webpage, and it basically just shows you all the cases in our community, and it will basically take every school and let parents be able to check to see, oh, if we had a case, when was that case? So you can go back and track, oh, okay, because you did have cases, but not the week of August 23rd through August 29th. So then you check the next portion of it, August 16th through August 22nd, you had 2 cases, right? So now you're like, we had 2 cases. How many kids go to your school?
750 kids.
So let's keep that in perspective. You had 2 kids who had COVID that were at your school. If there was going to be spread, it would have taken place over the next 10 days.
Right. Yeah.
But how many cases did you have the next week?
0.
So what does that tell you about our mitigation?
It's working. Yeah.
This right here, right? Our hand washing, our masks, our ventilation,
Exactly.
our air filtration,
Right.
right? Because we're gonna get into that. You see our chief business official, he's got a ream of paper there. He's gonna read each one by one to everybody.
3 hours.
3 hours later, you'll get to ask your first question. Diego, will you hold up that notepad just so people can see the questions that are coming out? There we go. All right.
Cool.
So we have Diego here with us, and he's taking notes that you're plugging into the chat. He's going to do his best, so your forbearance is greatly appreciated. But what we're going to do is we're going to actually just pivot to start talking about air quality, to start talking about the county and state recommendations regarding air quality. This is the time of year where we start to see a lot more activity. For those of you who haven't experienced that, you may be new to San Mateo or maybe new to California. There's actually months that we go through this. If you recall the fire in Paradise, that was late in the year. I think it was in November when that actually took place. So, we've been experiencing a drought statewide for many years, and that leads to more activity in those forest fires, which leads to air quality concerns that follow very kind of predictable time of year patterns, but each fire is a little bit different, and the effects change with the geography as well as the intensity of the fire. But as a district, we have quite a bit that we learned from last fire season, and then quite a bit that's actually happened leading into this school year. So what I'm going to do is I'm going to turn it over to Patrick for a few minutes to talk about I think one of the things most parents want to hear is we have 21 schools, right? And we've heard a lot about these air purifiers or air filtration. They call them HEPA, HEPA. And do we have them in every class? Are they at every school? So talk a little bit about that.
Well, in response to COVID, when we were looking for solutions to assist us with the air quality, the CDC, the Center for Disease Control, and ASHRAE, which is the American Society of Heating, Refrigeration, and Air Conditioning Engineers, came out with recommendations as part of reopening schools. And they had several different suggestions for school districts to implement. And in response to that, we district-wide went through and looked at a couple different options for us. But we introduced into all of our classrooms the HEPA filters that Superintendent Ochoa referred to. But in addition to that, we looked at our HVAC system throughout the whole district, and we replaced where we could systems that had the capacity to house MERV 13 filters. And folks, if you look at it, it's MERV, MERV 11, MERV 13, we're going to talk about. And in other systems we had, which are older systems, we replaced older filters, which were MERV 7 filters, with MERV 11 filters.
Yeah.
So
I saw a visual online that showed it's kind of like a scale.
Right.
The MERV or MERV filters, they actually start really low, like MERV 6, right?
Yeah.
Then there's MERV 7, MERV 8, 9, 10, 11, 12, 13.
Right.
But it actually goes beyond that to 14, 15, 16, 17. And so 5 years ago, many schools in this district were at the MERV 7 level.
Exactly.
They were sort of at the very bottom level.
Right.
And right now, district-wide, we don't have any schools that are at the MERV 7 level. And we've upgraded them to MERV 11.
That's right.
But there are a handful of schools that are MERV 13. So talk a little bit about how that happened.
Well, the newer schools we have, there's been modernization that's been completed already. We do have MERV 13 filters at several of our sites.
And do you know which sites those are?
I could look it up for you off the top of my head. I couldn't cite it for you.
Yeah,
but,
we can actually add that into the video here. I'll have Diego do that at the end of the event.
But again, back to what we did in response to COVID is we introduced the MERV 11 filters, but we also worked with a partner and introduced these HEPA filters throughout the district too.
Yeah.
So, and folks will share with you too what their perspective is in an environment when you have both a HEPA filter as well as a MERV 11 filter. What might that equate to on the MERV scale? Right. So, folks will share and have shared with us that the combination of the MERV 11 filters and the HEPA filters is greater than or equal to a MERV 13 filter.
Yeah.
So where those in those environments where we couldn't put a MERV 13 filter in by putting in these air purifiers, in addition to the MERV 11 filter, it's folks have shared this. It's the equivalent of having a MERV 13 filter.
Now Abbott's one of the schools where you've got some buildings that are brand new. We were just there cutting the ribbon a few weeks ago. Those kind of facilities, they've got the upgrades.
Exactly.
They've got the MERV 13 and better because they're brand new. And actually, they built some new classrooms. Sort of that 2-story building that's next to your new gym, right?
Yes,
So I think is it 6 classrooms or 4 classrooms?
It's
Something
about
like that.
6 of them. Yeah.
And then it doesn't take much. You walk around campus. You've got some old buildings out there.
Very much so.
So you're the principal at Abbott Middle School. When you go into those classrooms, do you see those HEPA air filtration systems plugged in and humming and working?
Absolutely. In all our classrooms, even in our main office.
Yeah.
Counseling offices.
Yeah.
They're in any classroom, in any space that is occupied by staff and students.
Yeah. And what that's actually doing, because it's a HEPA rated filter, it's actually killing the particulates in the air. It's actually moving the air and purifying the air, basically.
That's right. Exactly.
Because I think what you don't want in a school setting is you don't want a space where the air is trapped, where outside air is not coming in, and where inside the room the air is not moving.
That's right. And when we go back to these CDC and national recommendations in response to COVID, the reopening plans, what they spoke to at the top of that list was seeing how much outside air you can bring into the environment. So what we've also done district-wide is we've manually overridden systems so that we maximize the amount of outside air. And there were guidelines and suggestions that both these entities produced, which recommended that you have a minimum of 5 to 6 turns of air per hour that are going through the system. So we work with
and the research does say they want 3 is sort of the baseline number, 3 air turns per hour, but the more,
Right.
the better.
Exactly.
So, I'm a parent, I'm driving up to my kid's school.
Right.
I see my child's classroom with a HVAC unit on the top.
Yeah.
What you're saying is we've actually opened up those air dampers,
Exactly right.
kind of like in a way in your house, when
Right.
when you don't want the air coming in or out.
Right.
But we basically opened up the external air dampers
Exactly.
so that the fresh air can be brought in
That's
to the
right.
HVAC unit.
That's right. That's right.
Yeah, because I think that's important for families to understand that in our district-wide today, we are at the maximum amount of fresh air coming in to our classrooms. There is no other aspect of the HVAC unit that could make more outside air come in, because one of the recommendations that is out there right now for school districts is purchase a CO2 sensor, so that what the CO2 sensor does is it calculates the amount of CO2 in the air to open the damper up. So what we've done is we've basically manually opened it up in advance. So there's no classroom that has the damper or the system modulating the amount of outside air, because we've sort of, if you can think about it, we've opened it all the way up. We've opened that faucet all the way up to get the fresh air in. And I think that's what one of the big questions is, sort of where are we with CO2 sensors,
yeah.
where are we with CO2,
Yeah.
district wide. So talk a little bit about that.
CO2 sensors as well too. So as you were saying to Dr. Wilcaba too, there are sections of his campus that are air conditioned and sections of his campus that are not air conditioned. And so we have, with the tremendous support of our community, we passed our bond measure, Measure T, and we have on our priority list, we brought forward to the board a plan to modernize our HVAC systems throughout the district. We have plans to install air conditioning in non-air conditioned space, and we talk about the correlation between student achievement and students being comfortable is one component, but there's also the air quality, which is another component. But we have a plan in place to air conditioned spaces that are not air conditioned currently, and to also upgrade older systems throughout the district. And it's an approximate $92 million project that will take place. We've got it broken down for 15 sites over the next 2 summers. 7 sites will be impacted this summer, and 8 sites will be impacted next summer. For those 15 sites, when we put in new systems, that installation of new systems will be accompanied with the installation of CO2 sensors.
So if I can just make this as clear to a family watching.
Right.
When you make this kind of substantial HVAC change, I mean, how many millions of dollars are we talking about here?
92 million.
We're talking about $92 million. So just so the public knows, a $92 million project takes time to implement. So we already implemented a portion of that at schools this summer.
That's right.
So now you have the project. It's in California, when you want to build anything new or change anything about your schools to use school construction money, you have to go through something called the Division of the State Architect, or DSA. DSA are letters no superintendent wants to hear. All I want to hear from DSA is approved.
Right, exactly.
Because DSA can be a very lengthy process.
Right.
But we've made some smart decisions to get our plans in early. So my understanding is our plans are in DSA
For
now.
the first 7 sites that I spoke about, our plans are in DSA, actively being reviewed currently.
Actively being reviewed. So if you can think about this sort of, DSA is I've actually been there.
I've been
in
there several
Sacramento.
times too.
Yeah, I've actually been
Oakland,
there.
I've been there.
Yeah, there's one in Sacramento. There's a big headquarters in
Right.
Sacramento. And, it's sort of, it's engineers and it's architects and it's construction managers who are basically going through your plans with a fine-tooth comb, and they're checking every aspect of what you're doing is correct. So when you send them in, they'll send you some notes and you'll make some changes. But we think the timeline is we'll be ready to hire a company in sometime in December or
Yeah,
January.
we hope to go out to bid in December, January, so for construction starting in June.
Yeah.
And there's a very short window
Yeah.
of time too, so.
When you go out to bid, you basically publicly announce, we have this big job, it's in the millions of dollars. If you own a company that does this, here's the packet of information of what we need. Submit your proposal. Then they all give us a proposal on a set date, and we typically pick the lowest bidder, right? You know, that's a typical process.
Yeah.
Once that's done, we still have children in school every day. So it's not feasible to send HVAC contractors during school to do this project. You know, we're talking about a multi-million, you know, like you said, $90 million project. So we want this to happen from June until August, and we think we can do 7 schools basically in the next 11 months, right? From June until August. And then the following year, we finish that process. So if I'm at home and I'm thinking, some schools have these new filters, the HEPA 13 filters. But you're saying having a plug-in air purifier that's HEPA rated, when you have 2 of them in a classroom, and you have a HEPA 11 HVAC system, it actually goes even beyond the amount of air filtration that a HEPA 13 would do all on its own.
That's right. That's what we've been told.
Yeah.
So just some other information to add to that too. There was discussion and logic behind the first 7 sites.
Yeah.
Because those first 7 sites are sites that have the HVAC systems are actually in the classrooms themselves for the most part.
Yeah.
And we have some middle school things we're focusing on too, and some pods. But in reviewing this with our partners, engineers and architects, they thought that the quickest way we could get to DSA was to tackle those classrooms that had essentially an identical system that's going to be installed into these spaces.
Mm-hmm.
So we tried to tackle the number of sites we could, the quickest, in the shortest amount of time we could, knowing that there's the DSA obstacle to get through.
Yeah.
But that's why the logic behind picking those first sites first. When we get into the second phase, there's a little more nuances. There's things on rooftops, as Superintendent Ochoa said, and other nuances and complexities, which the architects need some more time to get the set of plans ready to give to DSA for DSA to then review to give us back. So that plan is to go for next summer. And again, as the superintendent was saying too, we need to do this work while for the ones that are in classrooms while students aren't present. You can't go in, and you have to have a functioning heating system, right? Right? I mean,
what I also don't want to lose sight of is, as it pertains to 10 months ago, as it pertains to 16 months ago when the pandemic hit, we realized we were way in the past. We didn't have MERV 13 in classrooms. We didn't own any air purifiers.
Right.
We didn't own a single plug-in air filtration system district-wide.
Right.
So at the time, we were receiving funding to basically purchase those things. So we figured, okay, let's see what we can do to upgrade those to at least MERV 11. And let's also buy these plug-in portable units and get them installed district-wide. We spent quite a bit of money on that.
Yeah, significant amount of money.
This is a
Hundreds
major
of thousands of dollars on the units themselves.
On the units themselves, several hundreds of thousands of dollars. Now, we haven't thought, oh, that's too much money, we shouldn't buy it. We've said the health and safety of our students and staff is a primary concern, so buy 2 for every class. In addition to upgrading the systems to MERV 11 that we didn't have yet at MERV 11. So I think it's sort of logical on the parent side to say, okay, the district started with no air purifiers and HVAC units that were at the MERV 7 level. So where have we come from that point? Okay, well, here's what I would say. We're here. But to the parents watching, our goal is to get to here,
That's right.
which is to get to district-wide
Right.
MERV 13 with those continued air plug-in HEPA-rated filters.
I think the other thing, Superintendent, I would just add too, is that there are some other products we're having discussions with folks about,
Mhm.
and we want to make an informed decision about that.
Yeah.
And so we are having some discussion with folks about bipolarization units, UV light embedded units. It's bipolar ionization that's occurring. So
Yeah.
there's yet another risk mitigation
Yeah.
tool that we're looking at potentially introducing into our classrooms as well too.
Yeah.
We know that this time of year it's warm,
Yeah.
but with those air vents open 100%,
Yeah.
October's nearing, November's nearing, and I think we all have our fingers crossed that there's going to be a vaccine that's introduced for our young people.
Yeah.
But knowing that that is on the horizon, we're also having an active conversation with multiple vendors currently about potentially introducing yet another tool device into the environment that will also help with mitigation of the virus. So,
Yeah.
so we're having those active conversations too. And again, like you said, from a cost perspective,
Yeah.
that's what cost of the district would absorb and implement. The good news is that these vendors are telling us that they have devices in stock. So, during COVID, there was so much demand. There was a shortage at times of different things, but they've had these things in stock. So it's just another added layer. Whether, so it's something we're having an active conversation about too. So we'll keep you posted. Keep the community posted on that and the introduction of those things as those conversations unfold.
And I think that's probably a 3 to 4 week process. I don't think it's really far away.
No.
Right? It's
That's
sort
right.
of, if we were going to do it, it would happen, by the middle of October.
That's
is when I think we would legitimately have that in place.
Yeah.
Diego has a couple of sheets that he's going to pass over to me here.
All right.
We've done quite a bit of chatting back and forth at this point. Dr. Rubalcaba, if you want to help me, just from your perspective as a principal there at Abbott, have you started to hear a little bit more from parents about air quality? What have you heard? Has it been more quiet? Tell us a little bit about that.
In general, it's been pretty quiet on that front. I think the district and obviously school sites have done a fairly great job in kind of updating them on where we're going, and what strategies and resources we're putting into our classroom spaces, right, to help with that. So it's been pretty quiet.
Yeah, I'm hearing the same thing. I've got a first question here.
That's great.
Is the CPR AED training just for staff? No, the answer is no, because we have many people who volunteer with our schools. If you haven't ever been in a medical emergency and you haven't been trained, it's very scary to see somebody have a cardiac event or to see somebody have difficulty breathing. So I always encourage everybody to sign up because I think the more people that we have in the community that know CPR, know first aid, and know how to operate an AED, the better. It really achieves that level of calm and that feeling of readiness when, if and when somebody has a cardiac event or some medical issue come up. Whether or not sports will be delayed as a result of pooled testing starting on September 20th, I don't think so. We have another event this upcoming Wednesday. So Diego, if you can add that one to our list of items to check in with the district office staff. We want to make sure we get a clean answer on that. I don't think it will, but we have to obviously consult with our district office staff. We have a question on whether pool testing will be done outside because everyone will be removing their mask, and the answer is no. And the reason is that the process is done in a way where the student is physically not doing anything other than if you just do this, and not all simultaneously and facing each other. So it's an extremely low risk process. And the collection tube is not passed around from student to student. It's in a stable location, so there's more of a movement towards it. So that wouldn't be necessary. Permission slips, when will they be sent out? Actually, some principals want to give the parents permission slips in paper, so we're actually going to send them to principals tomorrow. Somebody at the school is going to have to enter it. That's the disadvantage of the paper version. There is going to be an online version. So some families might want to wait another few days for that. You've got a little bit of time, so, be on the lookout for that. But others might say, I want to sign up now because I want the district to know now, and that's okay as well. Mr. Gaffney, when will the remaining CO2 sensors be installed at all the sites?
So there's a plan to I'll try to make it brief.
Yeah.
The plan is to have, as I was saying to you earlier, that we have these 15 sites that are going to have new systems installed. And so the plan is that when the new systems are installed, the CO2 sensors will be installed in those systems. Because if air conditioning doesn't exist in that space, then the CO2 sensor, as you said, Superintendent, it's designed to interface with the air dampers associated with the air conditioning. And so that's the plan for those 15 sites. We have done a pilot of some spaces that do have air conditioning. We're partnering with a company by the name of MCOR, who is the company that we work with on all of the systems that monitor our air conditioning. They have walked several sites that do have air conditioning. I expect that sometime this month we'll get an estimate from them in September about what the cost would be to do those installations of those devices. The pilot that we did at 2 of our sites was successful in terms of making a transition from an older CO2 sensor to a new one. So those worked successfully with the systems we had in place. And so we expect that sometime in September for the air-conditioned portions of our campuses that have the capacity to house a new sensor, we expect to get an estimate sometime in September.
Okay.
And then we're going to learn more. We have a whole chart of classrooms that have sensors, that don't have sensors, and that there's been walks with several folks on our team, along with a vendor. So I expect sometime in September we'll have another update.
Perfect. And we have a board meeting on the 23rd, and we have another board meeting the second week in October. So there's some opportunities to give those updates. We will have another live stream next week, and then we start a process where we'll hold one of these every month. So we'll slow it down just a little bit and then hold special ones as they come up. I think what parents want to hear is we are installing the CO2 sensors. For schools that are getting all new units, they'll receive their CO2 sensors in the process of that new unit installation with the CO2 sensor included in it.
Right, exactly right.
That's right. Yeah. This is a good question. I didn't think of this because I started only 2 months ago. Did the district test 2 air purifiers in a low setting? I'm not sure I know.
There's a low, medium, high setting.
Okay, gotcha. In a low setting for filtering out particulates or COVID in a room full of students.
If I'm not mistaken, and I can go back and confirm with the folks who we work with on these devices, but my recollection is that in order to yield the number of air turns per hour with these systems, at the high setting, those systems themselves, so in addition to the MERV 11 filter that goes through this process of turning the air per hour with the air vents wide open, these independent air purifiers also on a high setting will turn that air in those spaces 5 times an hour too.
Okay.
So you have the 5 times an hour for the main filter, plus the 5 times an hour for the independent filter. So I haven't asked them to do the math on if the air dampers are wide open on our system and this is on a low setting, what does that result in? I haven't asked, but I can.
Well, maybe that's a good step for us to take. But
just reiterate, people to leave them on high.
When we bring, well, that's the first thing. But leave them on high, and they do make a little bit of noise. They're not, they're not, I don't know if you ever taught, or you probably did, when we had boilers, the boiler, when the boiler would turn on
Radiant heat.
and radiant heat
Oh,
was
yeah.
coming through. I mean, no, I taught,
It's like,
that was my first class. I had an actual, do you remember the coils?
well,
We had
yeah,
coils
exactly, yeah.
in the walls. So, that was noisy. It was a hum
Right.
all day long when
Yeah.
it was cold.
Right.
But I think this is more manageable,
Yeah.
even on high, it's just a noise you can sort of have in the background and get used to. There was an update in February, there was another update in May. The question is, are we on track? Has anything happened to delay us from May until today?
No, I would just tell you that I think that certainly my 23rd year in doing school construction, this district is very ambitious and very aggressive with their plans. So the fact that we had a plan in advance going into the election, as soon as the election occurred, we were moving forward really aggressively on signing contracts. We have water bottles being installed. We have vape detectors being installed. We've had multiple meetings with the community on our NPR projects, right? We have designs. Several of those are going into DSA.
Your old school is getting one, right?
It is.
Yeah. So, no, I feel we're very on track, and this is to do an update. We'll be glad to do an update. We have
The 23rd, on September 23rd, we'll have an update.
We have a new director of facilities and construction.
Amy Rufo.
Exactly.
Yeah,
So,
Amy.
which is just focused on that, and which is great. Amy brings a wealth of experience to the district as well too. So we're definitely on track.
So we'll give the September update, and then we'll give another one either at the end of the year or in January.
Yeah,
it's
sure.
another update on the process, but the message you're giving is we're on track.
That's right. Absolutely.
There haven't been any delays or setbacks. I've got a question about MERV filters. I think the question is, if a MERV 11 pulls outside air in, which can be bad during poor air quality, what steps would be taken in this kind of situation? So, because I think that's on people's minds. Like, okay, if you're bringing in outside air, what happens when we hit a day where it's 155, 160, 175, 180, and the air is rated as unhealthy? Should we be pulling in that much outside air?
Well, the other, from my recollection, and I'm happy to answer the question after I go back and look through some information too. But my recollection is in these guidelines from the CDC and from ASHRAE, it speaks to that in general terms. That says you should maximize outside air being brought in. Without a more explicit explanation, but barring other conditions that might suggest that you might want to minimize that.
Right.
And I think to me too, partly why we are having these active conversations with providers of yet another device is that in anticipation of what you're talking about, Superintendent Ochoa.
So like right now,
right
now we have the dampers open.
Right.
So let's say in 3 weeks, we have a fire event that affects us, that makes the air quality really come down. And Christian, you have the pictures there.
Yes, I do.
He's got, that's actually all available online, and we can push that out, Diego, tomorrow as well. When that happens and we close them down to, let's say, 10% open as opposed to 100% open, then what you're saying is that's where the district's third mitigation, which would be this potential additional unit, basically, right?
Exactly.
Talk a little bit more about that.
No, that's you're absolutely right. And in addition to that, what the independent standalone filters in the classrooms are still turning that air through a HEPA filter 5 times an hour. And the introduction of this additional tool, this bipolar ionization tool that we're having a conversation about, could also help mitigate and address some of those particles that are in the air. I couldn't explain this technology very well, but it basically it attacks those particles that are in the air, will send them through those purification systems so that they can be captured in those filters.
Right.
And that's my layman's explanation of it.
Yeah.
The other, just another factor I would just share with you too, which we're excited about and appreciative of the community support for the bond measure, because the process for us to change from 100% open to 50% open or less is a manual process. We have one HVAC technician currently in the district who who himself went across the entire district and shut down or opened up all those louvers. So
Yeah.
it's a manual process for us to do that. But with the automation system, with these investments that we're making with this, it's going to be automated in the future, but it'll be a manual process. So we'll respond as quickly as we have. That's why I think the other reason why having yet another risk mitigation tool will help us with this.
Great.
Well, and I think you just pointed out, going into the school year, we said installing sensors for CO2 is not something we can implement district-wide by August 13th. But something we can do is we can open those dampers.
Right.
But it's not a long-term solution because it does take time for a school district employee to basically devote themselves to go ahead and open those dampers up and then shut them. And a CO2 sensor does that without the human resource or the employee having to do that.
That's right.
And we do have the timeline for that, the 7 schools this summer,
That's
the
right.
next 8 schools the next summer.
Right.
In the meantime, the MERV 11s, the MERV 13s, the 2 units,
Right.
and then this new possibility, this standalone. Talk just a little bit more about this standalone unit that you're researching right now and maybe going to implement.
Yeah, we're talking to a couple different vendors about it. From a square footage perspective, what we're talking about is a system that has the capacity to be used in a 1,500 square foot space. The technology that we're looking at, the device we're looking at, they also have HEPA filters in them, plus the ionization technology too. So there's HEPA filters on top of HEPA filters, in addition to the bipolarization or bipolar ionization technology too.
Bipolar ionization.
So again, just another layer of risk mitigation. So it'll be an additional HEPA filter on top of HEPA filters, on top of the MERV 11 filter, plus that technology puts these negative and positive ions into the environment, which attacks these particles proactively, as opposed to, they talk about this passive thing, which pushes those through the filter, but this is a proactive that pushes these ions out into the space to attack those particles.
That's right. One thing that's critical is, Dr. Rubalcaba, you have the school air quality recommendations that are there. If you hold up the first sheet, just so the public can see. Again, we'll post these on our district website tomorrow, send it out to every family. What you won't see on there is a lot of real specificity about when a school would close. And I want to talk to the public a little bit about that. So there's a huge reluctance on the state's part to set a number like that for the entire state, because of the very significant difference between the geography of places like, if you haven't been to Mammoth, or places like Big Bear Lake versus Santa Monica, or versus San Francisco. So there's a sort of a hesitance to say one measure meets the standard for all schools. There's also a very overt attempt on the state's part to basically say, be careful about ever closing your schools, because some kids might not have air filtration in their home. They might be more safe at school than they are at home.
Exactly.
Or they might be unattended because their parents are working.
Right.
So they could be out breathing in the unhealthy air, or they don't have devices or computers to be able to be home. In our case, district-wide, that's not the scenario. The district is at 1-to-1 district-wide devices. The district is also at curriculum access, where we have our Math Nation for our middle school kids and our Zern Math for our elementary kids. Those are online programs, as well as Benchmark Universe for elementary reading, and that's online, as well as we have a real ability now to pivot to Google Classroom. Your teachers all know how to use it. They would know how to put things online. They would know how to assign work to kids. We would be able to use our system to hold Google Meets with our students. We have quite a bit of tools at our disposal. March of 2020 it was a different story. We didn't know how to get online with kids. And I think that's all changed now. So I think what parents are asking is, what are you going to do when the air quality worsens and you are bringing fresh air in as part of your COVID mitigation plan? Because that's the logical thing for a parent to say. Well, if you're going to reduce fresh air coming in, what's going to happen to the air particulates in the classroom?
Right.
And what you're saying is a couple of things. One is those plugins are actually moving the air 5 times an hour, and this potential additional unit with the added mitigation of the hand sanitizer, the face covering, the symptom screening, the modified quarantine when there's cases. If you can hand me that 4-week case guide right there. I don't want it to be lost on parents what we're dealing with district-wide. I just want you to think about this. There are 10,500 students in this district and 1,200 employees. So we happen to be very lucky. If you haven't seen the data on COVID cases throughout the state, San Mateo County is doing a great job. If you look down Central California, there are some counties out there that are really struggling in 3, 4, 5, 6 times the number of cases than other areas surrounding them. So I think we're in a bit of a different place when it comes to the spread. I think I look at our case data and I feel very proud that we have the kind of response, to use Dr. Rubalcaba school as the example. 2nd week of school, 2 cases. 3rd week of school, 0 cases.
Correct.
Right? So these were kids who, when we have cases in the district, a very high percentage of them are asymptomatic, meaning they don't feel sick. They get a test because, also think about what we're doing, right? We have thousands of COVID tests that we, along with Virus Geeks, are putting in place. So we're testing lots and lots of people in our community. We went 1-to-1 with devices. Next 2 weeks, we expect to get another 1,400 T-Mobile hotspots that we're going to get out to families. We bought curriculum that can go online. We have teachers trained to use Google Classroom. We have the academic infrastructure to offer online programs. And then you have, from the principal's perspective, when that air quality starts to deteriorate and it gets to unhealthy for sensitive groups, what will happen for families that have a child that has a bad case of asthma?
Exactly.
When it hits 105, 110, 120, what kind of things does your staff do to support those students?
Yeah, so communication is very important, right? Because that's really what's going to help us identify kiddos with either 504 plans, with medical histories, and just other kids, right, who might not have a 504 plan, right, who might still have a compromised system. And so we want to make sure that families call in the office, let us know. My team back at Abbott is very understanding, and we immediately inform all teachers, especially our PE team, to ensure that there's a limited activity for these kiddos, if any, depending on the case. Right, we really review every case and reach out to the families. When we start hitting that red zone, that purple zone, right, with air quality, we go into all indoor activities, right? And we have the space, thank goodness, right, with this new gym, right? We're able to kind of pivot within our campus, right, to go indoors. So classes that have normally, had the freedom to be outdoors, like maybe our music class with instruments, would then modify their activities so that they can all go indoor, right? There will be kind of a campus-wide limitations on physical activity. We will minimize opening and closing doors.
You basically talk to the PE teachers and you say, this student needs to have a modified, like, right? This student needs to, and actually the teachers need to know, because these kids are with their teachers all day long. So it's important for them to know, this child has some kind of a respiratory issue, an asthma issue, a compromised immune system, and for that reason, we're going to take it easy for this kid. And I think that's a pretty standard thing for a principal. You know, last year you were at Laurel, so you had the real little guys,
Right.
and now you're at Abbott, and so teenagers just have more independence. So in some cases, it's them telling, you know,
Speaking up, right?
advocating for themselves.
Right.
And talking, but then you're saying communication is important. So to all those middle school parents, call your school office.
Call them.
Yeah. Here at the district office, we have 4 nurses. We have Susie Riley, who's our coordinator of student services. They are extremely helpful. They know kids forwards and backwards, their cases. They can really step in to help with those kind of scenarios. What we've experienced so far is you kind of look outside, and most days it looks okay. You know, there's a big fire up in Lake Tahoe, as we all know. I think they call it the Calder Fire. That's moving forward, but we haven't had that really significant event yet. So right now, you know, we look outside and there's a little bit of concern, but then the day is likely going to come this year where you look outside and it looks scary. It looks gray, it looks dark, it looks red. It looks, you know, you walk outside and you can tell the air is different. It causes more labored breathing. And so families are going to want to know from the district's perspective, what are we telling principals? So when we reach unhealthy for sensitive groups, because that is one of the criteria, then we basically let our principals know. You email teachers, you let staff know, reduce activity. When it becomes unhealthy, which is an air quality index score of bumping up, then you basically say to all the schools, hey, we're doing PE indoors. We're reducing any kind of strenuous physical activity outdoors. We let our employees know, hey, greatly limit your time outside, work more, do projects inside if you can. And then it starts to get to what's called very unhealthy. And then from there, it can get to hazardous. So hazardous and very unhealthy is sort of where the debate is at right now. Is it a good idea to stay open when it reaches very unhealthy? When it reaches hazardous, for me, that's an automatic school closure. Like there's just no way to have hazardous conditions and require people to come to work and people to travel, to leave their home, and for people to basically attend school, children that have major medical needs that are not being addressed. So I think that's important. We are going to, if you look up other districts' websites, I want to encourage families to do that. Go on other district websites. You will find a very hard time finding a school district that says, we will close schools when it reaches this number. That's hard. No district is doing that right now. Actually, they're really discouraging us from doing that. My strategy is to start this conversation with the community, to hear from parents, to talk to educators about this, because I think it's better to basically get to the point of saying, we know where our line in the sand is. And when we say, this is the point that we decide to close a school. The other thing is, you could reach a point where you think it's okay to stay open, but if people don't send their kids to you, why are you open? Families will look out the window and say, you're not going to school today. It's dangerous out there. I'm not sending you to school. So we don't want to get to that point either. I saw a question pop up on the live chat. I'm learning, Diego, how to watch the live chat while I talk. That's probably a reason I shouldn't sit in this chair. I should sit in this chair. I'll look at the chat less. I want to talk about the source that we use to monitor air quality. So if you go online and type in San Mateo air quality, you will get Purple Air, IQ Air, BAAMD, AQMD. You'll get Air Now. And so we use a combination of the Bay Area Air Management Quality District and the Air Now data. And I want to talk about why that is. When the pandemic hit a year and a half ago, and then we had the fires hit not long after that, months after that, there was actually a big push in the community for people to go out and buy these sensors that are that use light to calculate particulates in the air. And it's tied into a program called Purple Air, and there are thousands in this area. So if you look online, it'll actually give you a reading for each one. It's like open sourcing air quality. The variability is very high. So what we are doing is, because the Bay Area Air Management Quality District is tied to the state's infrastructure, they don't have as many sensors. They have 30 sensors, and they're in specific locations. What they do is they actually bring in the air and they calculate the number of particulates in the air. But they do it less often, so it doesn't have the pizzazz of a every 10 to 15 minute update that gives you the air quality. So you run into situations where on Air Now it says that we're at 72 moderate, but on Purple Air it says 117, because Purple Air is like happening every 15 to 20 minutes. But the research indicates that the Air Now, which is connected to the Bay Area Air Management Quality District, is the most accurate. So that's what we use. They do a 24-hour forecast. So that's kind of how we're thinking about it. We'll check the data multiple times throughout the day, 9, 12, 3, 6 p.m. And when we hit a number on a forecast, like let's say today's good air quality, but let's say it forecasts tomorrow to be unhealthy for sensitive groups, the school district will send an email to all the school employees saying, tomorrow is expected to be a day that is poor air quality for all, for children with and individuals in sensitive groups. That will initiate to you as the principal, to your teachers, like, oh, I need to be paying attention to my employees and to my students who may have asthma, who may be on my list of sensitive group individuals. Now, when we have, during the day, we started out with good air quality and it got worse, we would send that out every 3 hours, an update to the staff. So we'll check again at 8 in the morning. If it's changed, we'll send it out at 8:05, right? So that's sort of our commitment, is in the morning, lunchtime, right after school, because remember, we do have after school programs, and then once more at night. So it's 4 times during the day. Most days are uneventful. Most days are in the 30, 40, 50, 60, 70 range. But we do check and we do track. And that, going down the list, we'll be producing that, we'll be giving that information out. I think when there are school districts that are not at 1-to-1, the idea of having students learn from home is really scary. We don't have that concern. We are at 1-to-1. When there are districts that have low internet access, there are many districts throughout the state that have, basically Wi-Fi dead zones. There's just no access to Wi-Fi because of the physical geography. That's not really the case here. Although I do want to complain about the Verizon over at Laurel. I have Verizon. I can't get a signal at Laurel Elementary School. So whoever's out there that works for Verizon or lives in that area, help me out, guys. And I think what parents, Diego, I don't know if you have another question over there for me that's air quality related, but I'd be willing to take it now.
It's just more of an HVAC.
Yeah. We'll circle back to this in just a second. Yeah, so the unhealthy for sensitive groups, again, that starts at 101. The unhealthy starts at 150. And then the very unhealthy starts at 201. And so that's where, those are the sort of the markers we're looking at. Again, Diego Perez is going to send this out to all families tomorrow. Real clean, crisp, easy to read visuals. The documents that Dr. Rubalcaba is showing are going to be sent out to families as well. I think what we want to make sure families are aware of and staff is aware of is we're trying to be smart about any risk. COVID risk, mitigations. Fire, sort of air particulates, fire event risk, very safe. Multiple mitigations to include things like changing the PE. You've got it. If you can share with me that chart here. So this is a chart that we'll send out once it hits level 3, which is unhealthy, sensitive individuals, exercise indoors, avoid vigorous outdoor activities. So don't send the class to run the mile. I was over at Bowditch today. We have a PE teacher over there doing volleyball indoors. The kids were all wearing masks. I thought it was really great. But we're going to not do that on a day where it's, or we're not going to have them outside doing a volleyball because these kids were really running and going for it, right? Exerting that, right? So you're going to give them an activity that doesn't require that. Reduce or increase rest breaks. Give during recess. Have them play indoors, right? Have them do recess indoors. I was a former elementary school teacher. We deserve some kind of an award when we teach all day and then also have our kids in recess indoors. Parents, I can't tell you what it feels like to be an elementary teacher, have all your kids all day long, and then also have them do recess indoors. It's I don't know, what do it's like break dancing on a tightrope or something. It's really hard to do because you set up your classroom so that it's a place of learning, and then when your principal says, hey, your kids are doing recess indoors, it turns into was it Mardi Gras? The kids are wearing
unstructured.
It's unstructured. It's supposed to be unstructured. I would always tell the kids, who wants to do art? Okay, you can color anything you want, because you just want to keep your class environment ready for learning. Intact as much as possible. So we've got, I don't know, Diego, if you have any additional questions for me right now. I think, what the message I want to give to the families is we'll actually be back here again next week. We've got a couple of loose ends we're going to tie up. We're going to give some more input and information. I've been reading in the chat, air ionization has been a hot topic. We're going to bring that back. I think there's some folks who don't think it's a good idea, some folks who do think it's a good idea. So we'll dig into that a little bit more. You'll have a presentation on September 23rd for the school board. We're actually going to try something new with your presentation, Patrick. We are going to do a process where we are going to post the item publicly a couple of days early. And this is your update on HVAC. And then we're going to actually send an email to all our families saying, hey, send us your comments on this presentation in advance. Right. So you're going to actually get their comments before we officially hold the meeting, so that when you and Amy Rufo present, you'll be able to say, we received 3 emails, 7 emails on this topic. Let me go through them. You might even want to update your presentation. Yeah. Based on the feedback. So one of our trustees, Cheryl Watkins, and I talked about this idea a couple of weeks back. We've been sort of, in a way, kind of trying to find the perfect item for this. I think yours fits that bill. It's complex. So at a school board meeting, it's hard to just cram all your comments into 3 minutes. As you know, we limit public comment to 3 minutes. And then on topics, usually 20 minutes, or, it can be extended. But I think if we give people the presentation a little bit early, then they're able to ask their questions and
It's good.
your presentation will improve, basically.
Absolutely.
Yeah,
That's
and there'll
great.
be more of a back and forth with
Interactive.
families, much more
Good.
interactive.
It's good.
So that's what we have. I don't know. What do you think, folks? It's
Great.
it's
Great.
six it's 6:37, so I'm gonna turn into a pumpkin in like 3 minutes. All my carriage is gonna fall apart here in just a few minutes. We are back here at 5:30 next Wednesday. I did see on the chat, why not have somebody with HVAC experience? We might do
Sure.
that. We'll reach
A
out.
lot of folks.
The person has to be willing to be on YouTube. I want to let parents know not everybody is a huge fan of being on YouTube. So just kind of understand that. I want to thank you, Dr. Rubalcaba. Thank you, Patrick.
Thank you, Diego.
Again, thank you,
Appreciate it.
Diego. And then
Thanks,
Diego,
Diego.
if you can just click the end stream button there. There we go. Yeah, and just, send us out. Thank you, folks. Yeah, and there we go. It just takes a minute to do that.